Hello and welcome. Today we're diving into the world of eye health to understand a common condition called papillary conjunctivitis. We'll explore what it is, what causes it, and how it's managed. Get ready to learn about protecting your peepers. So, what exactly brings on papillary conjunctivitis? The most frequent culprit is allergies, particularly seasonal allergies or reactions to eye drops or contact lens solutions. It can also result from chronic eye irritation, especially from poorly fitted or dirty contact lenses. Less commonly, it can be linked to certain underlying systemic conditions or even reactions to ocular prosthetics. Let's look beneath the surface. In papillary conjunctivitis, the conjunctiva, the clear membrane lining the inner eyelid and the surface of the eye, becomes inflamed. This inflammation leads to the formation of small, raised bumps called papillae. These papillae are essentially an exaggerated immune response, with the conjunctival tissue reacting to the irritant or allergen. The release of inflammatory substances further contributes to the redness, itching, and discharge. Papillary conjunctivitis is a relatively common condition, especially among contact lens wearers. Allergic conjunctivitis, a major contributor, affects a significant portion of the population, making them potentially susceptible. The prevalence can fluctuate with seasonal changes, such as during pollen season or due to regional variations in allergen exposure. Anyone who wears contact lenses or has allergies is at a higher risk of developing it. Now, how do you know if you have it? The hallmark symptoms include redness, itching, and a gritty feeling in the eyes. You might also experience increased tear production or discharge, which can be stringy and white. Upon closer examination, especially when the eyelid is averted, the characteristic papillae will be visible on the inner lining of the eyelid. Contact lens wearers may notice discomfort or even intolerance to their lenses. Diagnosis is usually straightforward and based on a thorough eye examination by an eye care professional. They will carefully evaluate your symptoms and examine your conjunctiva for the presence of those telltale papillae. Your doctor might also ask about your medical history, allergies, and contact lens use to help determine the underlying cause. In some cases, allergy testing might be recommended to pinpoint specific allergens. While we don't typically classify papillary conjunctivitis into rigid types, it's more useful to think of it in terms of its cause. For instance, we can differentiate between allergic papillary conjunctivitis, triggered by allergens, and giant papillary conjunctivitis, often seen in contact lens wearers and characterized by larger papillae. Understanding the specific cause guides the treatment approach. Fortunately, papillary conjunctivitis is usually manageable. The first step is to identify and eliminate the underlying cause. For allergic cases, antihistamine eye drops and mast cell stabilizers can help control the allergic response. Contact lens wearers may need to temporarily discontinue lens use, switch to a different type of lens, or improve their lens hygiene. In some instances, topical corticosteroids might be prescribed to reduce inflammation, but these should be used with caution and under the guidance of an eye care professional. Lubricating eye drops can also provide relief from dryness and irritation. Prevention is often the best medicine. If you have allergies, try to minimize your exposure to known allergens. For contact lens wearers, meticulous lens hygiene is crucial. This includes washing your hands before handling lenses, cleaning and disinfecting lenses properly, and replacing lenses according to the manufacturer's instructions. Avoiding overwear of lenses and ensuring a proper lens fit can also help prevent irritation. The prognosis for papillary conjunctivitis is generally excellent. With appropriate treatment and management, most individuals experience significant improvement in their symptoms. Continued research focuses on developing more effective and targeted therapies, as well as improving contact lens materials and designs to minimize irritation and reduce the risk of developing this condition. Keeping up with the latest advancements in eye care and consulting your eye doctor regularly are key to maintaining healthy eyes.